Hello, this is David with Questor. What is the difference between medical diagnosis and nursing diagnosis? So this one is one of the biggest sources of confusion in nursing school. Oh, they sound similar, but they're not the same thing. Think of this in this way. The doctor diagnoses the disease. The nurse diagnoses how the disease is affecting the patient. Let's break them down. Medical diagnosis. A medical diagnosis is identify the illness or condition. Example could be pneumonia, heart failure, stroke, diabetes, sepsis. This is basically the doctor saying, I know what's causing the problem. The medical diagnosis usually stays the same until the disease improves or resolved. The nursing diagnosis. Now ask yourself, how is this illness affecting my patient? Not what disease do they have. The nurse is basically saying, okay, now what problem can I help fix? Because nurses don't treat the disease itself. We treat the patient response to the disease. For example, pneumonia. The doctor says, pneumonia. The nurse thinks, impaired gas exchange, ineffective airway clearance, activity intolerance, imbalanced nutrition, anxiety. So the disease is the same, but every patient responds differently. Another example, heart failure. The doctor, congestive heart failure. The nurse, impaired gas exchange, excess fluid volume, activity intolerance, risk for impaired skin integrity, decreased cardiac output. So the heart failure didn't change, but the nursing diagnosis depends on what the patient is experiencing. Let's go for a third example. Stroke. The doctor, ischemic stroke. The nurse, impaired physical mobility, impaired verbal communication, risk for aspiration, self-care deficit, risk for fall. So we don't just see the stroke, we see what the stroke is doing to the person. So here's the biggest difference. Medical diagnosis asks, what disease does the patient have? The nursing diagnosis asks, how is this disease affecting the patient? So one identifies the problem, the other identifies what the nurse can do about it. Think like this. Imagine your house is on fire. The medical diagnosis says, the house is on fire. The nurse diagnosis says, the people can breathe. They are dehydrated. They are anxious. They have burns. So the fire is the disease. The people's problem are what the nurse treats. Remember, medical diagnosis usually stays the same. The nurse's diagnosis can change every shift because the patient condition change. Today, they may have impaired gas exchange. Tomorrow, they may just need activity intolerance. So the nursing's diagnosis evolves as the patient improves. So when choosing a nursing diagnosis, don't ask, what disease does my patient have? Ask, what problem can I, as the nurse, assess, monitor, prevent, teach, or improve? That's the answer that the NCLEX is looking for. So remember, medical diagnosis identifies the disease. Nursing diagnosis identifies the patient response to the disease. Doctor diagnoses the illness, nurses diagnoses the care the patient needs. That's what makes nursing unique. And thank you for watching. Please like and subscribe for more of this content.